This video will talk about how to approach a case of amenorrhea in the long clinical consultation of the MRCP PACES exam. This is a symptom that usually candidates do not prepare beforehand for, but it can come up as the main presenting complaint as well as in the review of systems. So we'll talk about why it's important to ask about menstrual history and birth control pills and pregnancy in any case where you encounter a female patient. So these are some of the differentials that can come up. These are mostly causes of secondary amenorrhea. So pregnancy, hypothalamic disorders, pituitary dysfunction, PCOS, premature ovarian failure, thyroid and adrenal dysfunction, and medications. So we'll talk about how to rule each one of these out. I won't talk about the exact definition of primary amenorrhea. It's a bit more intricate than given here. So, just roughly, if the patient is not menstruating by the age 15, it's primary amenorrhea. It is not pertinent for for a medicine exam. So, we'll focus on the causes of secondary amenorrhea, which means the cessation of menstruation for more than 3 months in a patient who was previously menstruating. So let's start with ruling out each and every condition. If you're just starting your preparation, I have the beginner's guide video up on the channel and the history taking pattern. If you're not familiar, you can watch those first. Okay, so the number one thing that you need to rule out is pregnancy, although it's not going to be the differential diagnosis in the exam. But if you don't ask about pregnancy questions and don't rule it out, you might lose marks in the clinical communication and clinical judgment skill. Okay, in the beginning, after the introduction, you can, supposing that amenorrhea is the main presenting complaint, you can ask about, okay, when was your last menstrual period? And instead of asking about, have you been sexually active? This is a very direct question, especially early on in the conversation when the rapport hasn't really been established between you and the patient. You can ask about, okay, do you have any regular or casual partners? And is there any chance that you might be pregnant? This is indicating that they might be sexually active. If they're unsure, you can ask about, are you using any birth control pills? And then ask about symptoms that might hint towards pregnancy, such as, have you been feeling sick or throwing up? Do you have any soreness in your breast? And have you been gaining weight? Okay, this is going to rule out pregnancy. Next thing would be to rule out pituitary causes. Then ask about, okay, do you have any children? And how old is your last child? Have you lost any pregnancies or have any miscarriages before? And if the patient has been recently pregnant, ask about, okay, how was the pregnancy? Were there any complications during the pregnancy or childbirth? What we're trying to ask is, during childbirth, if there's excessive bleeding or if the patient is unable to lactate after that, it can point towards Sheehan syndrome. So you need to ask, okay, were you able to breastfeed your baby after that? Have you been feeling tired or dizzy recently? Again, pointing towards a pituitary cause. Ask about, do you have any headaches or changes in your vision? Ask specifically, have you been experiencing any blurring of vision, any narrowing in your vision or tunnel vision? Have you been bumping into things? This is going to be because of the mass effect of a pituitary adenoma. Have you noticed any breast discharge? This is for galactorrhea in patients, in non-pregnant patients, patients who haven't recently gave birth. So this can point towards a prolactinoma. Next thing, ovarian causes. So PCOS, very common. You can ask about, have you noticed any acne, any changes in your weight, especially weight gain? Have you been having trouble losing weight? Any changes in your body hair or facial hair? And before your period stopped, were your periods previously regular or irregular? Irregular periods, weight gain, inability to lose weight, facial acne, facial hair all point towards PCOS. A really important differential would be that of premature ovarian failure. Ask about, have you been experiencing any hot flashes, any excessive sweating at night, vaginal dryness or pain during intercourse? Ask about family history of any similar symptoms or conditions. Ask about, do they have any medical history? Have they ever been hospitalized before? Have they gotten any surgeries or procedures done? Don't ask about chemotherapy or radiotherapy directly if the patient doesn't mention cancer or a history of cancer. Because if you do, it can catch the patient off guard. It can be a bit jarring because patients are usually aware of what chemotherapy is. So it can catch them off guard. What do you mean by chemotherapy? Do I have cancer? Ask about medical history, hospitalization, surgeries, and procedures. Asking her about procedures also includes gynecological procedures that can lead to Asherman syndrome, although that is not pertinent to a medicine exam, but still need to rule it out. Next, very important are thyroid and adrenal causes. For thyroid, ask about weight changes, difficulty in adjusting to extremes of temperatures, feeling tired more than usual, sweating or feeling sleepy at the daytime, tremors. Next thing would be ask about any changes in their skin color, maybe any darkening, especially the palms of the hands. Ask about facial hair and changes in the voice. So, hoarseness of voice or voice changes can either denote maybe hypothyroidism or secondly, virilization because of an adrenal tumor. Lastly, the hypothalamic causes take a systemic review and then go to the personal history. What do they do for a living? And have they been experiencing any stress at work lately? The weight changes have been already asked. Then ask about do you have you been following any strict diet, any recent changes in your diet, or have you been working out more than usual? Ask about do you have any history of any eating disorders? So this is going to rule out anorexia and bulimia as a cause of amenorrhea. Ask about medication history. Tell them to show, are you on any medications? Please show me your medication list. And if they don't have any, you can ask about do you take any over the counter medications or any herbal medications or any supplements or are you on any birth control pills? Do ask about steroids too. So, steroids can disrupt the hypothalamic pituitary axis, so it's important to ask about any long term use of steroids. So what's really important is besides this is the premature ovarian failure. So step by step, when you're asking about past medical history, let's suppose the patient mentions they have diabetes, type 1 diabetes. Okay, noted. Next thing, you're taking a systemic review. You ask about, okay, have you experienced any changes in your bowel habits? And they mention, yes, I've been having diarrhea. And you probe about the diarrhea, and it turns out that they have a gluten insensitivity. Okay. Next thing, they mention that they've been experiencing dizziness, weakness, fatigue, and you think that it could be probably related. So, what you're doing is you're one by one finding out some autoimmune conditions. A myriad of autoimmune conditions can be because of autoimmune polyglandular syndrome, and you need to specifically rule this out. It's a very important differential and can come up in the exam. So, if whenever just make it a rule, whenever you find one autoimmune condition, rule out others. For example, diabetes, thyroid, Addison's, celiacs. These are really important. Okay, next thing, just a recap. For the menstrual history, you're asking, okay, what age did the period start? Were they regular or irregular before they stopped? Was there any pain during the period, pain during intercourse? Ask about pregnancies, miscarriages. Were there any complications during the pregnancy or during childbirth, such as heavy bleeding or inability to breastfeed after it? Ask about medical conditions. Ask about family history. And social history is important in every case of LCC. Asking about smoking, alcohol, any stress, any recent changes in diet and exercise. Then asking about the social aspect of it and how it's affecting the patient. This is really important in the exam. Please do not forget about this. So how is it affecting your life? How is it affecting your personal life and your any problem with your how is it affecting your work life? So ask this. It's since it's not a communication station, a counseling, a detailed counseling is not usually required, but you need to ask about it and offer empathy and any solution if you can. This is what we discussed in the first slide, the differentials, and just one or two questions that can rule all of these conditions out. Number one would be pregnancy. Ask about last menstrual period, use of birth control pills, and symptoms of pregnancy. Weight gain, feeling sick, throwing up, and soreness in the breast. For hypothalamic causes, stress, eating disorders, weight loss, strict diet, and exercise. For pituitary causes such as prolactinoma, Sheehan's, pituitary apoplexy, ask about any complication during childbirth, excessive bleeding, headaches, vision changes, galactorrhea. That is abnormal breast discharge. For PCOS, there's acne, facial hair, irregular periods, weight gain. For premature ovarian failure, hot flashes, night sweats, any chemo or radiotherapy, and family history. For thyroid dysfunctions, weight changes, appetite changes, and the fatigue, if any, and difficulty adjusting to extremes of temperatures. For adrenal causes such as Cushing's, ask about any tiredness or weakness. For muscle weakness, you can ask about do you have any difficulty combing your hair? Do you have any difficulty standing up from sitting position or difficulty walking upstairs? You can ask about changes in their voice and any facial hair. And while examining, you can look for stria. For the medications, hormonal therapy, birth control pills, and steroids are really important. So when it comes to the examination, starting with the general physical examination, asking for the vitals, including a blood pressure or postural draw if needed, examine the relevant system. So in the history, you'll be guided towards what system we need to examine. For example, for the thyroid, you need to examine the neck, proximal myopathy, reflexes, also the eyes if needed. For Cushing's, you need to examine general physical, look for stria, look for bruising, look at the neck, look and examine the abdomen. For pituitary causes or hypothalamic causes, you can examine you need to check for the visual fields, especially if the visual symptoms are given, such as bumping into things or tunnel vision. So this is it. I hope this helped. If you need any help with other symptoms that you've been having difficulty with, you can leave a comment or DM me on Instagram. Follow Paces Guide on Instagram, and you can send me a DM there. If you want one-on-one coaching sessions, I offer coaching sessions for both LCC and communication, for communication only, and I'm offering mock sessions as well. So if you want to take an online mock exam based on the exam criteria, exact exam format, you can send me a DM and register for it. A crash course for communication, a 3-day session covering almost all categories of communication. And this is a long course, 10 days in duration, covering one LCC and one communication in an hour, and the feedback and key will be sent to you. So, thank you for listening.